We have a quorum and it is also the appointed time. Let me call the meeting to order. Item 1. Information papers issued since the last meeting. We did not have any papers issued. Items for discussion at the next meeting. Maybe you're aware of that already. 2 items have been proposed. Number 1, updated progress of Child Development Fund. Number 2, progress on the implementation of home care service for persons with severe disabilities. Members, any views? Deputy Chairman, Ms. Chen Yun-han. Thank you, Chairman. Some elderly people came to see me recently. They were all concerned about aging in place. We have a paper on that today at the meeting. The elderly people thought that consultation had not been carried out satisfactorily, and also the problem has not been resolved. They are a joint group. They would like to speak to LegCo. So I'd like to bring this up here. They say they have a lot of criticism against the government, which asks them to age in place, but then the government is not giving them any support. In fact, the services have been retrograding. The government has proposed a paper today, but Chairman, I'd like to ask you when we can listen to the elderly people direct. Mr. Tan Kap-yu? First, I'd like to respond to Ms. Chen Yun-han. If I remember correctly, we had such a hearing before the summer recess. Over 10 deputations came. Now, what should we do if it is about the same issues? I think there are many things we should chase the government on. Say, for example, number 4 in the list of outstanding items, review of disability allowance and the system for processing applications thereof. 1 year has lapsed. They have said that they have appointed the CPU to do employment needs for the disabled. They said that that was scheduled to be completed by the end of 2014. So at least they should come back with a report in 2015. I think we should start to heat up the stove on this issue, so to speak, or else we won't have enough time to go into it. I think this is also an important thing. We are talking about disability allowance. Secondly, Mr. Leung Chi-chung, who is sitting beside me, said that we should review the OALA. I think that is necessary. It has been with us for over a year. The administration is singing praises of it, saying that the elderly poverty problem has been reduced. Okay, Mr. Leung Chi-chung, Chairman. In the community, there is heated discussion on elderly-friendly community. I understand the Hong Kong CSS is actively promoting it. However, we need the help of government departments to create an elderly-friendly community, but it seems the government departments have not expressed their stance on the issue. I think we should ask the Hong Kong CSS or government departments to come along to give us a briefing on this topic. In Yuen Long, we are starting to do it, but without the help of the government, we can only ask the SWD to do publicity. It seems we are not providing enough support for elderly people in the community. We must mobilize different government departments to do this together. I think that is a very meaningful task. But first of all, we need government departments to register their stance on the matter first. Maybe the Legislative Council can push government departments to register their stance and then help to promote the issue. Thank you. We have already mentioned 4 issues of concern. We have to attach priorities to them. Under the item today, elderly program plan, I think that is urgent because by February, the stage 1 public engagement will be finished. Let me ask you to consider my view. At the LegCo here, we have not done any territory-wide consultation on this. I use the word territory-wide because I don't think this is only limited to the welfare field. We have not listened to the public's views on this one. So perhaps between January and February, we should organize a special meeting so people within and also outside the sector can express their views. Of course, we'll invite the administration as well. That is the first response. As for disability allowance and the OALA review, first of all, we need to seek an understanding with the administration as to how prepared they are, or else it doesn't help even if we have a meeting on these issues. I would propose we have these two in February. Mr. Tan Ka-Piu, do you think you can wait? Because these two are important matters. Well, it is not a matter of me being able to wait or not. Let us press the government to do something. We have already had items for January. Unless we take out one of those two items, I would say the first one, which is the Child Development Fund. Maybe that can be taken out for the moment. I think they're just getting prepared and maybe progress may not be substantial. And perhaps we can advance the review of DA and also OALA. If the administration is ready, we can swap the items around. But at the very least, they should come with a report in February. Mr. Leung, you mentioned an elderly-friendly community. I think that is important and it is interdepartmental. Let's see whether we can fix it for March. We still have nothing as yet for the March agenda. Okay, can we have that as one of the agenda items in March? Deputy Chairman, I agree with you, Chairman. Because aging in place has been discussed before, but there has been insufficient consultation and it gives people the impression that the administration is just putting up a show and the elderly are criticizing the situation. We did quite a bit last year. We gave many views, but the administration has not exactly responded to us. The administration always says that old people should age in place if conditions permit, but then there is no package of support facilities and the elderly are left in the cold. The joint meeting is asking whether the administration will also supply support measures so that people can age in place, which is a good idea. I think that has been discussed, but the discussion has not been in-depth. I would agree with Chairman that we should invite the elderly to come along. I heard many concrete examples, and perhaps we should do this on the LegCo platform. I agree with what you proposed. Okay, if you don't have other views, we will do as I said. So the Deputy Chairman, myself, and the clerk will communicate with the administration. And perhaps we can have a special meeting to deal with this. But as to the agenda items for January and February, we will talk to the administration first, all right? If you have no questions, we'll go to item 3 of the agenda. Setting up a new contract residential care home for the elderly with a day care unit at welfare block of Shek Estate Phase 2 Public Rental Housing Development, Shatin. We'll invite the administration to come in. Attending for this item, we have Mr. Donald Chan, Deputy Secretary for Labour and Welfare, Mr. Lam Kai Tai, Deputy Director of Social Welfare Services, and also Mr. Kenneth Wu, Chief Executive Officer from Social Welfare Department. Welcome to you. Perhaps the administration can walk us through the paper briefly. Deputy Director, is that right? Thank you, Chairman. Members, this is a discussion paper briefing you on the government's proposal to construct a contract residential care home for the elderly, or contract RCHE, with 150 places and a 30-place daycare unit for the elderly, or DCU, at the welfare block in the PRH development of HA at the site of Shek Estate Phase 2. The financial provision will be met from the Lotteries Fund. People are aging and there is an urgent need for institutional care. Therefore, one of our major measures is to build residential care homes in order to increase the service. At the same time, we are going to also strengthen community care to support aging in place. We'll also set up daycare centers for the elderly or daycare unit for the elderly which are attached to RCHEs, so we can provide daycare for elderly people. Therefore, in this contract RCHE to be built, apart from 150 institutional places, there will be a 30-place DCU. It is a daycare unit for the elderly. Starting from 2001, the SWD has awarded contracts through open tender to NGOs or private operators in respect of 26 purpose-built RCHEs. As at end September 2014, 22 are in operation, providing a total of 1676 subsidized places and 1197 non-subsidized places. 9 of these 22 contract RCHEs have DCUs on the premises, and they provide a total of 210 daycare places. The remaining 4 contract RCHEs, together with another 3 new contract RCHEs, will commence service from this financial year to 2016-17, providing a total of 532 new subsidized RCS places and 281 non-subsidized places.
嘅單位上邊呢，呢幾間嘅院舍合共會提供
Parafor, a total of 102 places will be provided in DCUs attached to these new contract RCHEs. Since there is an urgent need for RCHE places, we have earmarked sites in 11 development projects for the construction of new contract RCHEs with DCUs and DEs as detailed in Annex 3. This is going to be a new contract RCHE with DCU, and it has a net operational floor area of about 1725 square meters. It has a shared lay-by and 2 exclusive use parking spaces. The HD will design and construct the bell-share premises for the contract RCHE and DCU with the parking spaces according to the specifications of HD. The SWD will be looking for the NGO suitable to operate the RCHE with the DCU after it is constructed. According to the HD's current project schedule, the bare shell premises will be completed in around 2018. We plan to provide 90 subsidized RCS places. 90% of that, meaning 81, are to provide nursing home places. And 1 or 10%, 9 of the places, will be for care and attention places upon admission.
And there will be 1 designated residential respite care place and 16 non-subsidized RC places and 30 subsidized DCU places in the proposed contract RCHE with DCU. Taking into account the lead time required for rectification of defects and selection of the operator, we aim to award the contract for the operator of the proposed contract RCHE with DCU in 2019. In November this year, the Lotteries Advisory Fund Committee endorsed a capital funding of $109.22 million to meet the construction cost of the proposed contract RCHE with DCU in the subject development. As for the purchase of furniture and equipment, the SWD will seek funding from Lotteries Fund nearer the completion of the construction works. Now, looking at the present administrative arrangements, we will seek the approval of the Finance Committee for the LF project, which will give rise to additional recurrent financial implications exceeding $10 million per annum. The estimated recurrent funding requirement for the operation of the proposed contract RCHE with DCU in a full year, including personal emolument, etc., is $21.98 million after netting off the income of service users fee. HD consulted the Shatin District Council on the subject PRH development in September 2013 and further presented a detailed proposal of the development to the Development and Housing Committee of STDC at its meeting in September 2013 and October 2013. The committee did not make any adverse comments for the proposed welfare facilities. Well, here ends my presentation. I hope my members can support this project. From item 3 to 5, we'll be looking at some funding requests. So we have invited all LegCo members to attend these sessions. And I would like to remind members, according to 83A of our rules, members should not move any motion if there is conflict of interest, and they should not speak on such items unless they disclose their conflict of interest. So I would like to remind members that if you have direct or indirect pecuniary interest involved with these items, please make a declaration before you speak. Now we have 5 members who would like to ask questions. I will read out their names. Tan Ka-Piu, Wen Xiu-ping, Chen Yuen-han, Leung Chi-cheng, and Tam Yu-chung. Each member would have 4 minutes. Mr. Tan Ka-Piu. Thank you, Chairman. I have looked at today's agenda. I think the government officials have made a lot of effort to try to meet the demand for RCHE places. So I think they've worked very hard, but and actually I should not criticize them. However, there is still a need for me to comment. Now, when I look at the past year, well, actually in June they also came to the LegCo. It's about another RCHE. At that time is 29,400. Now is 39,000. In 5 months' time, we have 5,000 more elders waiting in the line, and they are very old people. We only have 90 subsidized places. Within such a short period of time, there has a significant increase, so we really are not providing enough places for them. And if the audit has not criticized you, you would not have included the 6,000 odd elders. They are classified as non-active cases. And last time when you reported to LegCo, you didn't give us this figure. If we add this figure, then now we have 37,000 elders waiting. So why do you have to cover up? In the audit reports, it's clearly stated that although they are in active cases, hundreds of them have been housed in RCHEs in the past year. So why don't you give us all the figures? Why do you have to hide these 6,000 odd people? We are very concerned about the increase. We are all very worried. Why do you have to cover it up? With regards to the 6,883 elders who have been waiting on the central waiting list and which have been classified as inactive cases, well, we didn't intend to cover up this figure. Please allow me to explain to you about this 6,000 plus elders. In 2003, when we launched the central waiting list, because we had a standardized assessment at that time, and after the assessment we found that some elders should be put in RCHEs and some should be put in care and attention homes or some in nursing homes. So we thought that some of them could be put in the community and they can age in place. So we had a policy at that time. If the elders, after an assessment, we found that they could be allocated to RCHEs, or they were also fit enough to stay to age in place. Well, sorry, I have to interrupt you. Actually, I'm trying to help you. I want to fight for resources for you. But if you hide the figures from us, how can I fight for you? And for this 6,000 odd elders, they have undergone the assessments. They have genuine needs. They have raised their hands. They say that they want institutionalized service. And they are physically frail. They need care and services. Why do you have to hide this figure? I don't understand. Is it because you cannot meet the demand, so that's why you want to water it down? I don't understand. We didn't have any intention to water it down. I would like to tell you about these 6,800 members. Although they were classified as inactive cases, at any time if they told us that they really had such a need, we would cater for their need. So that means they are really waiting in the line. I'm sure the Deputy Secretary has heard you. We are trying to help the government. We are not scolding you for hiding the figures. If you give us the figures, then we will have a full picture. Mr. Poon Siu-ping. Thank you, Chairman. Now, we do not have enough places for the elderly. So it's very difficult for us not to support this proposal. However, I would like to find out more details. Just now you said that when the housing department builds these premises, they cannot complete the works before 2018. And you also have to remedy the details, etc. So the contract can only be granted in 2019. So it will take almost 2 years. And we won't see these places in 5 years' time. So can you speed up? Of course, it's housing department project. You may not be able to push them out. But how about the contract exercise? Can you speed it up? And also about the recurrent financial implications. You estimate that each year it's $29.98 million. Of course, that covers raise, remunerations, etc. So in the year 2019 to 2020, this will be included in that year's budget. So after 5 years, I'm sure there will be an increase in pay. Has this been factored in? Can you give us the relevant information? Just now we mentioned 2018. This is when this project will be completed. It will be completed in August. This is the estimation of the housing department, because in March next year, the welfare the foundation works for the welfare block will start. As for the contract, whether we can compress the timetable for it, we will try our best to do that, because we will have to wait for the completion of the SWD welfare block before we can issue the tendering papers, and then we will invite operators and NGOs to respond to the tendering exercise. When we vet the documents, we will try to compress the time. As for the recurrent financial implication, that's about $21 million. Well, we'll look at the actual situation, and yes, that will be after several years' time. We will definitely look at the MOD. That is, we'll look at the pay levels at that time. So for the financial recurrence implication, now we are saying that is $21.98 million. We are just using the present year's standards or levels for calculation. After a few years' time, of course, there will be adjustments. As for compressing the contract time, how much can you do that? Now, when we do a tendering exercise, we will give people 6 to 8 weeks. That is, I will give 6 to 8 weeks to NGOs or potential operators. Then they would submit their tendering document within this period of time. We will vet the tendering document. This is internal work. So for the part of internal work, we will try our best to shorten the time. Normally, we would need 3 months to do that, because we normally will receive huge piles of tendering documents. Mr. Chairman, Ms. Chen Yunhan, good morning. I have several questions. Now, we are talking about a number of RCHEs, and this one in particular, it will be in a welfare block. Now, before the summer recess, all members at the FC agreed that more RCHEs should be built. So what is the policy now? Will all future PLH developments comprise such a facility? Now you are putting this in the welfare block. Does it mean this will happen to all the PLH development in the future? Well, this is a welfare block. It's not only for the elderly. I have another question. There is a serious shortage of places. The government should have a policy in place. So what's the timetable? Well, you will be constructing this welfare block. So why is it still under construction? You cannot open the RCHE. Just now when you answer Mr. Poon, it will take about 5 years for the block to be completed. So you really have to take all this into consideration. As for the welfare block, it's a Shek. I'm not talking about this particular one. Before the summer recess, we asked the government to reserve sites in new PLH developments for RCHEs. At the ground floor, there are a lot of places that can be used for this purpose. So what is the policy like now? Whenever there are new PLH developments, we will put welfare facilities in it. For the RCHE with DCU that I mentioned just now is within the Shek Estate PLH development. A standalone welfare block will be built, but it's within the PLH development. Yes, I've seen that. I'm familiar with welfare blocks. They provide all sorts of services. I do not object to putting the RCHE there. Just now, members asked about the 6,000 non-active cases. It seems that you don't have to do anything about them. Actually, I can also ask you a lot of questions concerning that. Well, for welfare block, is not a designated RCHE. So at the ground floor of PLH, most of the time we just plant trees. That's no facility. Well, if you make it look nice, then elders would like to use it. You can make a park there.
That is quite different from welfare blocks. Have you been pushing through that policy? Well, yes. In PRH development, we do situate RCHEs, and I give you an example. In Annex 3, we mentioned that we have 11 projects, 11 sites. 7 of these are within PRH development projects. Let us look at Shatin. Since we are talking about Shatmun Estate in Shatin, we also have Shui Chun O and also Fo Tan in Shatin. Mr. Lam, let me ask you this question. I am familiar with Shui Chun O in Shatin. It is a big estate. I think you can provide more places than 100 as stated in Annex 3. I understand there are many blocks in Shui Chun O. Do you have a policy to tackle this, especially when the demand is so pressing? Perhaps the DD can answer that question later. Mr. Leung Chi-chung, Chairman. My question is similar to Ms. Chan's. You have chosen places to build RCHEs and RCHEs with DCUs and DEs. I think you have chosen new estates or vacant sites to do so. At this site, it is quite a good idea because you have this place next to an estate, and it has a floor area of about 20,000 square feet. And you are going to build a welfare block. I don't know about the other facilities, but I conjecture you are also going to provide daycare units, and also the RCHE with the DCU will be put together. But I don't understand something. This is a kind of territory-wide service. This is not a dedicated center for Shatin only. So would you also look at the demand in different districts before you would provide the places? You say in this paper that there is an urgent need for these places, so why are you only providing 150 places? This is the same question as Ms. Chan's. In existing estates, you don't build welfare blocks, but you use the ground floor of blocks to provide RCS for elderly people. And the elderly are integrated with the residents. But here it is an independent block, and people will know this block houses the elderly. When you design the services, should you also consider the affordability in a way of different districts, including medical services and transport? If not, you should provide 300 places instead of 150 because it is a virgin site. According to the OZPs, this site is for high-density residential development, and the area for community services is limited. We are already maximizing the use of the site with its attending constraints. The plot ratio is only 0.5 for non-residential use, and for residential use, the plot ratio is 6. And we have maximized the potential of the site. There will be 7 stories in the welfare block, and the RCHE, sorry, I may not be following you. The elderly people are going to live there, right? So it should not be 0.5. You should not use the plot ratio of 0.5. It seems I cannot follow your argument. The welfare block is going to house certain people, but is it because it is not a residential block, so you cannot regard it as residential use? That's correct. RCHEs are regarded as non-residential use when it comes to plot ratio calculation. Therefore, the number of places that can be provided depends on the area available. 5 stories of the 7 stories of the welfare block are already used for the RCHE. Well, DD, as a government department, I think you have the responsibility to talk to the planning department about this. You should provide more places because there is a pressing need. You should not accept the plot ratio of 0.5. I thought you were worried about the capacity of the district to also include such an RCHE. But if it is a planning issue, I think you should take it up with the planning department. I think the DD has heard you. Mr. Tam Yu Chung, in fact, we all support such projects. We are just saying you are doing too little, too late. I have more or less the same question as Leung Chi Chang. You provide only 150 RCS places and 30 daycare unit places. We are asking you to do more, so more elderly people can be accommodated. You said 5 of the 7 stories are already used for elderly institution care. Is it because of fire services considerations that you cannot build a higher block? And also, is it that the daycare places will not be included in the calculation because they don't stay for the night? It's just that we want you to provide more institutional places. And I think Ms. Chen Yun-han also made the point that you make use of the ground floor of PRH as RCHEs. We used to provide kindergartens on the ground floor, but now because of the aging population, can you not provide places for residential care for elderly people and mentally handicapped people on the ground floor? I think she is asking you whether you would consider doing it, especially at new estates. Is it that you are not going to do that at new estates, but you tend to put everything in a welfare block? Are there such planning considerations? DD? According to the RCHE ordinance, the blocks cannot be more than 24 MPD. If the building is too tall, it cannot be used as an RCHE. Secondly, at Shek Estate, there are 4 PRH blocks. Block 3 has a childcare center with 100 places on its ground floor. So there is this service facility. And also in the welfare block, as I said, 5 of the 7 stories are used as the RCHE. There is another story for residential care, providing 30 places for mentally handicapped people and also mildly handicapped people. Thank you, Mr. Leung Kok Hong. Chairman. Mr. Tam Yu Chung asked about a 7-story building. I think that is a very old law. My question is, I have no expectations of this government. We asked them to clear the occupied sites for 2 months, and still they are saying, I will announce when the time will come to clear the sites. What kind of CE is that? The DAB supports him. And also, there cannot be any resistance when the sites are cleared. We have already said that we would be quite willing for you to clear the sites. He has been the CE for 60 months, and people have occupied the areas for 2 months, and he's refusing to have a dialogue. He's refusing to take up responsibility, and he is forever delaying his question and answer session at LegCo. We cannot rely on him. He says there should be dedicated funding for dedicated projects. Mr. Donald Zhang was not good at all, but he now C.Y. Leung has assumed the post, and Mr. Chen Maobo, of course, is his staunch supporter, and C.Y. Leung had to spend a lot of time to explain why he should not be suspected of pollution or corruption. And you go to the town planning board does not stand on your side when you go there for land for the elderly. And as for NENT, you want to put housing there. We have already told him to use the golf course so we can solve the entire problem. and Mr. Tam Yu-chung's request can be met. Now you say there are too few places. At NENT, we say there should not be a golf course. Elderly people don't have places to live. And I was talking to Mr. Frankie Yek. We don't even have niches or columbarium for people who die. What kind of a government is this? They say we are creating trouble. I'm not talking about universal suffrage. We are talking about his strong point, and that is to be good to the elderly. But what has he done? Xi Jinping will come to Macau. We should put this to the president. This is what you loyalists do. You scratch the surface. Today I really have to take you to task. There is a 3% increase for the higher band civil servants, but not for the people in the middle and the lower band. What are you doing? The administration sees the need for increasing the salary for higher band officers so they can have more luxurious trips outside Hong Kong, but you are blind to the plight of the elderly. Now let me propose this to you. You cannot have the building with more than 7 stories, but why don't you go underground like the Pacific Place? They are cheating with the plot ratio. Is it possible for you to go underground? So government offices and councillors' offices can be subsumed underground so elderly people can live in the building above. Talk to Chan Mao Po or Paul Chan. Also dig a ground hole for C.Y. Leung. Can you do that? Is it possible? I'm asking you about the rules and regulations. Would you be able to provide underground facilities without that being fed into the plot ratio? So all high-ranking officials should work underground. They go to hell, and elderly people go up, not to heaven, but in the structure above. Is that negotiable? Ask Paul Chan to consider this. Don't just build subdivided units. Mr. Leung Kwok Hong, I think you have proposed the view. But ask them whether they can dig a hole in the ground for C.Y. Leung. Well, I don't think the officials can answer this question. Next, Mr. Fernando Zhang. Thank you, Chairman. Members here across the political spectrum are telling you not just to provide RCHEs in welfare blocks. You are talking about the lack of land, but every time you tell us you need to find land to build welfare blocks. But you can do something with the PRH. Maybe you use units in the lower floors. We have done our sums. Including this year, the CE has said that between 2014-15 to 2017-2018, there would be the building of 67,800 units. In other words, these are PRH. If we only take out 2%, in other words, about 1,352 places, and if we can house 4 people in a unit, we are talking about 5,408 places for elderly people. I'm talking about subsidized, institutionalized places, and it's by no means a small figure. You are just talking about over 10,000 subsidized places in RCHEs being provided. If in the next 4 years, including this one, there can be a big jump in the provision of places, can the SWD look wider and further? Later on, we are going to have another item for mentally handicapped people, but it is so far away. It is totally segregated from the communities, and it is actually within a correctional institute. You should actually go to PRH because that will afford the best integration. We have been asking you to do this all these years, but you haven't progressed a bit. We won't object to having a welfare block. We'll certainly support you. But why don't you seek full integration with PRH so the elderly will actually live in a community? And these RCHEs do not have to be of big scales. You don't have to provide several hundred or 1,000 units every time. You can go for smaller structures.
For example, 20 places, etc. I understand that you have to look at the economy of scale. However, if the units are smaller than, or if the complex is smaller, then the elders would feel that they are actually living in a community more. We've been promoting aging in place for many years, but that has not been materialized because there have not been enough supports. So you just send the elders to the LCHEs, just like sweeping them under the carpet. We do not want elders to live like this. We want them to live in dignity. Can you give time to the officials so that they can answer? Didi? Well, for PLH development, we would try our best to find sites for this purpose. Some are underneath PLH blocks, and some are still within the boundaries of PLH development. We would build a welfare block, but it's still within PLH development. If you want certain PLH units to be converted so that they can be used as LCHE units. As for our contract LCHEs and subvented LCHEs, most of them have more than 100 places. And we need 70,600 square feet for that purpose. So if we convert PLH units, then we will be cutting down the number of PLH units. Well, for the PLH units, well, for PLH developments, how many LCHE places will be provided in the coming 5 years? Now, if you look at Annex 3 of our paper, there will be 7 such developments in PLH developments. I'm not talking about welfare block. I'm not talking about elderly units in PLH developments. Later on, I can provide you with the figure. But for Annex 3, you can look at items 7, 10, and 11. They are welfare blocks within the boundary of PLH development, and they are just next to the PLH blocks. I'm not talking about this. I'm talking about PLH units, not the welfare block. Maybe later on the DD can follow up. Mr. Kwokaki, Chairman, I think nobody would object to this project. However, we have tens of thousands of elders waiting, and the reply from the government showed me you don't have the figure. Professor Zhang, I don't think it will be above 250. It's written here, so I don't think it can help much. So policy-wise, should the SWD talk to the Transport and Housing Bureau? You need more sites or more places. For example, the lower floors of PLH. And actually, ground floor areas are wasted nowadays. Now, for example, Fudong Estate, the ground floors have not been used, and then HD took up some of the sites, and actually these ground floor spaces were just used for ventilation. And in the past few years, some of the vacant units on the ground floor have been converted. In some PLH, many of the ground floor places are not put to use. The places are there, but they have not been put to any use. So I hope the SWD can go check out all the PLHs, because many spaces are like this. And in some old estates, the old ground floor stores and shops are not operating. For example, near Chinwei, next to it, is a market, but the second floor has been left vacant for a long time. The SWD has always been passive. It hasn't taken any initiative. So LCHD, LVHD, HD, they have a lot of empty premises or vacant premises, but the SWD hasn't done anything. Now, first of all, they have to tell us policy-wise when they talk to other bureaus, and they also have to check all the vacant premises, and the government should do something to them. Well, the government is now allowing some NGOs to rebuild their facilities, but that will take a long time because they still have to go to the town planning board. So I think the SWD should provide us with such a list. Now, Didi, you've heard our councillor, and later on the Secretariat will send you a paper asking you for such information. Well, they have to count all the PLH. I would like to respond to a point. Now, you're talking about vacant units in PLH, not just vacant units. Have you been to the PLH? I think you are living in a luxury district. Have you been to PLH? So for the ground floors of many PLH, a lot of the spaces has not been used. It's totally not used. Some of them has been converted into district councillors' offices. That's it. Have you been to Futong Estate? Now, you know, for Futong Estate, they have converted some of the ground floor spaces into hostels. So in some old PLH or old HOS, they have many ground floor units like this. I don't think he knows about that. It seems like he's dreaming. He knows today. Mr. Chen Chi-chin, thank you, Chairman. Well, we always say that there's a shortage of places, and the government would always say this: aging in place as the core, institutional care as backup. It's also stated in this paper. And I would like to ask about daycare places. In Annex 2, we only see 102 places. That is number of subsidized daycare places. Are you satisfied with this? Do you think it's a very low figure? And now, this time around, we see 150 residential care places and 30 daycare places. Now, how do you come up with such figures? When I look at Yuen Long and Tuen Mun, they have two projects. The daycare ratio is much higher. Well, when we set the number of places, we will look at the floor area that's available for this kind of service. As for daycare service places in Hong Kong, we have 70 daycare centers for the elderly, or RCHE with DCU, and 2,867 places are now being provided. When we build new contract RCHEs, we will continue to increase such units, and one unit will offer about 20 to 30 places. We will also be building standalone daycare centers for the elderly, and they will usually have 30 places, a bit more. So now we already have 70 of them. Of course, we will try our best to provide more in the future. So you do not have a policy principle. You would have to look at the floor area, and then you would decide on a number of places. Of course, we would also have to look at the waiting list and find out how many elders are waiting for such a service. As for daycare service, normally the elderly would have to wait for about 7 months. Thank you. Mr. Lang Yu-chung, please be succinct. We are running late. I would like to ask about the long-term policy. We talked about it before. For new RCH, can a number of can a certain area be designated for RCHE? Can you confirm this point? Yes, for new PLH developments, we will be including RCHEs. As you can see in Annex 3, we have 7. Well, for a PLH, if there is there only one RCHE, or you can build one RCHE in each block? Because if you allocate 2 or 3 stories in each block for this purpose, then there will be a lot. For a PLH development, we will have one RCHE. Now, some may house 100 or 150 elders. Now, for some PLH, they would have the first floor for this purpose. If you do this, then a lot of the problems can be solved. Can you think this way? Not just one RCHE in one PLH. Can you have more than one in a PLH? Yes, we can discuss with the housing department. We will try our best to get more floor area so that elderly service can be provided. Didi, I would like to seek clarification. Just now you talked about 7 new PLH developments. So the RCHE will not be in a welfare block. It's at the lower floors of residential blocks, right? Well, some of them are housed in welfare blocks. I want to know whether at each block you would allocate certain space for RCHE. I can provide the relevant information later. Among the 7 developments, I understand that some of the RCHEs are located at the lower floors of residential blocks. Just now, the DD said that the timetable can be compressed. However, you still need 3 months. Well, the tendering period is 6 weeks to 8 weeks. So for the whole exercise, it will last for 3 months. So I hope that you won't start the tendering exercise after the completion of the construction works, because by doing so, you can save time. Just now, Mr. Pun Siu-ping also mentioned this. This can be compressed. You can do it simultaneously. Then you can save time. I remember we mentioned it at previous meetings. I hope this can be done. And also, we mentioned before a number of ways to do it, including purchasing places from private RCHEs. But now this is not operating smoothly. Now you use the level of 50%, I hope that it can be increased to 80%, so that the service quality of private RCHEs can be improved and more people are willing to go to private RCHEs. We suggested this many times, but you still maintain the level at 50%. So I would like to reiterate that members have asked for this a number of times, that is by increasing the percentage of purchased places. Now, just now you mentioned new PLH developments, and the housing department is willing to give you the ground floor area so that some facilities can be built. So I think that is good because the housing department is not closing its door. However, other than doing this in new PLH developments, there are existing PLH, including Fudong estates mentioned by Dr. Kwok, and lately I have also been to the Southern District. I also saw that the ground floors are left vacant. they are existing PLHs. If the housing department allows you to use this kind of space, then you will immediately have a lot of floor areas. And you don't have to do it just at new housing estates.
Members, this is a funding request. I'd like to ask you whether, in principle, you support the submission of the funding request to the Finance Committee. I have not heard any objection from members. Any objection? If not, the committee or panel supports this funding request. Next, item 4 on the agenda. Setting up an integrated rehabilitation services complex at the site of Kaineng Sheltered Workshop and Hostel in Kwun Tong. Can we ask the administration representatives to come in now? We have the Assistant Director of SWD, Mr. Fong Kai Leung, Ms. Joyce Tam, Commissioner for Rehabilitation, also Mr. Kok Chi Leung, Assistant Director from Social Welfare, also Mr. Kenneth Wu, CEO from SWD, as well as Mr. Lai Chok Man, Senior Architect from SWD, who will walk us through the paper, please. We have seriously overrun. Please be as brief as possible because we have the paper with us. Ms. Tam. Yes, Chairman. This paper proposes to construct an integrated rehabilitation services complex, or IRSC, at the site of the ex-Kaineng Workshop and Hostel in Kwun Tong. According to para 12 of the paper, there will be the provision of 300 institutional care services, 210 day services, as well as the reciting of 3 IRSCs to this new place. I'd like to point out that this new development project will allow us to make better use of land resources. The area for development will be increased, and also we can have 10 stories instead of 4. And also there will be better services provided. As for the funding request, it will come from the capital cost will come from the Lotteries Fund. And if we can have the funding in the first quarter of next year, we can start the project in the second quarter of 2016 for completion in the third quarter in 2018. And during construction, we propose to invite operators to come back with proposals papers for operation during the construction so that we can tie in with the timetable better. This is my very brief introduction. I welcome questions. Thank you, Ms. Tam. I'd like to say again that this is a funding request, and I'd like to remind members to pay attention to ROP 83A with regard to declaration of interest. I have given you the details at the last item. Members, any questions or comments? Very good. If members have no comments, I will ask you whether you support the submission of the funding request in principle. That is, whether you support the submission of the funding request to the Finance Committee. Any objection? If not, you agree with the proposal, and I thank the administration team. Next, item 5. Setting up of an integrated rehabilitation services complex at the site of the ex-Siu Lam Hospital, Tuen Mun. I think we have the same team here. Ms. Tam, is it that you will take us through the paper again? Please? Yes, thank you, Chairman. This is a proposal to construct an IRSC at the site of the ex-Siu Lam Hospital in Tuen Mun. According to para 13 of the paper, the development will provide 1150 residential care places and also 550 daycare center places, totaling 1700. This is quite a big project. The plot ratio has also been much enhanced from below 0.3 to 1.39. But because of aviation routes problems, there will just be 4 stories. And again, the capital cost will be taken up by the lotteries fund. Since it is a big development providing many places, we believe it will provide quite a bit of relief to residential care, daycare, and also occupational rehabilitation places. We have already consulted the Tuen Mun District Council, the Social Services Committee under it, and also we have been consulting residents nearby. They have shown concern towards the environment, the transport and management of the project. We have done feasibilities on these already, and we have already reported back to the community groups and also the Tuen Mun District Council. This is my briefing. Thank you. Thank you, Ms. Tam. Again, this is a funding request. I'd like again to remind you of ROP 83A with regard to declaration of interest. I have given you the details of the relevant ROP at the last 2 items. Members, any questions or comments? Mr. Tam Yu Chung? I don't have a question. I think it's a good idea. I'd just like to remind the administration representatives that actually in Tuen Mun, there is private land where rezoning can be done, and I believe institutional care can be provided there, and there are vacant school premises which can be used for providing RCHEs. Perhaps you should look for more sites in Tuen Mun. Last night, I talked to some NGOs, and they said people are applying for rezoning of private land. And also, they'd like to rezone school premises that have been left vacant. But the Lands Department and other departments may not be very positive or proactive because they are not responsible for elderly services. I'm therefore urging you to liaise with the Lands Department and the Planning Department, perhaps, so you can look for more sites in Tuen Mun, so you can provide more residential care places. Maybe AD, Mr. Fong, can answer the question. Thank you, Chair. I'd like to thank Mr. Tam for his view. The administration has been cooperating amongst the different departments through different channels, and we are exploring the exact proposals of Mr. Tam. I would be very happy to make use of sites in Tuen Mun. Say, we are going to include certain vacant school sites in our plan. Like this one, this piece of land we're talking about here, it is very precious, and it has been included in our plan exactly through the way Mr. Tam proposed. Any follow-up? Mr. Leung Kwok Hong? You talked about aviation routes, yeah? That's what I heard you. Are you talking about flight paths? Yes, yes. This is a site that has been used as a hospital. I am asking the same question. If you can't go up, why don't you go down into the ground? This is the first question. Secondly, talking about rezoning of land use, I have been telling the administration this. Many people have sites. They may be hoarding up these sites, whatever, but they have been waiting for the land to be rezoned for housing purposes, private housing. Do you have a policy whereby if it is a piece of agricultural land, if it is not put to farming use, and 2 or 3 years later you can resume the land? Do you have that policy? Can you do that? Or else how can you look for sites? We have land in Hong Kong, but there is mismatch. Is that such a policy? You always say there is no land. Mr. C.Y. Leung is fiercely scrambling for land for housing purposes. But have you talked to the Development Bureau for doing fresh planning on our land? Mr. Matthew Chung, has he done his homework and come up with a view as to how much land you need to achieve your objective, if there is any objective? In my view, you have no objective. And then, according to internal government procedures, you can ask C.Y. Leung to tell Paul Chan to rezone the land. So you can take it up with landowners, whether you can have PPP or otherwise. In my constituency in Shatin, there is a mismatch. You gave 2 hectares for a hospital operator, but only 1 hectare is used for building the hospital, and other hectare is being used for building luxury flats. What is your policy? Have you been doing your utmost to get land? Have you talked to other government departments that there are things that you cannot wait, so you need land? Did you ask Paul Chan to help you, or are you just here to say you have no land? Would you like them to answer you? Yes, please. Mr. Kwok. Chairman, Mr. Leung. If we needed sites for welfare purposes, we have been talking to the planning department and other lands-related departments. We have reflected our needs to these 2 departments in the main, and some sites have been given to us for consideration for welfare purposes. We have very close liaison with those departments, so yes, we have reflected our needs to the departments. But maybe not every site they give us is suitable. Sometimes the site is too small. But whatever can be used would be the subject of active consideration for welfare purposes. This is a regular and standing practice. Whether we can build anything underground, we will give that consideration in the feasibility studies. We will look at the soil condition and the geotechnical conditions, and if possible, we can consider subsuming some facilities underground, so we can free up more space above ground for providing daycare or overnight services. This is our standing practice. Well, Chairman, your time is up. But like this one, you have land right next to it. You can try to link up the 2 sites. Your point is made. Mr. Chung, the Chairman. Thank you, Deputy Chairman. I understand Siu Lam is quite remote, without a lot of transport access, and there are no residential developments around this site. I'd like to ask about manpower planning. How many drivers are you going to provide, and how many cars that you would provide? In other words, do you have enough transport complement for this IRSC and the day center? Who will take the question, please?
I would like to supplement, Madam Chair. For this project, we have reserved, or we're planning for 33 parking spaces. Well, some of them are for loading and unloading, and some of them are for fire engines, etc. So for the whole design, we have also prepared for some transportations for example, to commute staff and for the inmates' families to use, etc. So we are making such arrangements so that both staff and family of service users would not find it inconvenient to go to the IRSE. We have factored all this in when we do the design, and also there are some public transports available. Later on, we will be discussing with the transport department and see if minibus routes can be arranged. We understand that there is a need for better transport arrangements, so we have cars, parking spaces, and other facilities in place. Yes, of course, if there are minibus routes, that would be great. However, I am concerned about the operation. If you are just providing the IRSE with 1 or 2 drivers, I think that would not be enough. Well, this is a block grant. You can use the money in whatever way you like, but if you just earmarked an amount for hiring 2 drivers, that would not be enough. So how about the operating cost? Because it's a monthly issue. So now we have to ask the government clearly, in your design and in your subsidy, how many drivers would be hired? Mr. Fong? Well, for the Siulam IRSC, we have 12 car parking spaces. I'm not asking about parking space. I'm asking about drivers. So you will have 12 drivers for the operator. Well, I think this has to be put down in record. I don't know whether 12 would be enough. I'm asking this question because this is not a facility in the urban area. Is quite remote, so drivers are very important. Now, if you give them a vehicle, it will last for a long time, but if you do not give them drivers, then the vehicles will serve no purpose. Yes, I would like to thank the member for his views. Now we will take members' views into consideration, and when we invite NGOs to submit their applications, we will highlight the importance of transportation and staff deployment. Okay, any other questions? If not, then shall we decide that we support the submission of this paper to the FC? Okay, next item, Elderly Services Program Plan. We have Ms. Annie Tam, Permanent Secretary for Labour and Welfare, Mr. Donald Chan, DS for Labour and Welfare, Mr. Steve Shek, Principal Assistant Secretary for Labour and Welfare, Mr. Lam Kar Tai, Deputy Director of Social Welfare, Dr. Ernest Chiu, Principal Investigator of the Consultant Team. First of all, will the government official take us through this paper? Yes, Madam Chair. We have submitted a paper to the panel on the Elderly Services Program Plan. Members may remember that the CE in his 2014 policy address has tasked the Elderly Commission to prepare the program plan within 2 years. So to do this, we have done 2 things. First of all, the Elderly Commission has set up a working group to follow on this. Now, other then inviting members of the EC to join this working group. EC also agreed to co-opt 5 members outside EC. And we have members from different walks of life. You can see the list at the annex. And also a consultant team led by some university professors have been set up, and they will be providing assistance to the working group. There are 8 members on this team. In the annex, you can also see the members. As for the methodology for formulating the program plan is structured into 3 stages, namely scoping, formulation, and consensus building. As for scoping, it will be from July 2014 to February 2015, formulation March to November 2015, and consensus building from December 2015 to May 2016. The EC hope that in July a report will be submitted to the government, and this will be within the 2-year limit asked by the CE. As for stage 1 details, they are set out in the paper. As for the first stage, it has already started. We have already had 5 focus group meetings. We have received 15 written submissions. Also, Mr. Chong Kwok-chi has also given us a submission. Now the consultant team is looking at these views, and it hopes that by February 2013, it can help the EC to delineate the scope, and then we will start stage 2. So this is stage 1. We hope to hear members' views on this. I and the consultant team will listen carefully to members' views, and at this scoping stage, we will take members' views into consideration, and then we will proceed on to stage 2. Now I would like to ask Dr. Ernest Choi to tell members more. I'll give you about 5 minutes, Dr. Choi. Thank you, Chairman. Thank you, members. On behalf of our team, I would like to tell members about our plan. I'm sorry that our members are otherwise engaged, so they can attend today's meeting. As Ms. Tam said just now, the consultant team is to assist the EC and its working group to formulate the elderly services program plan. We use 2 major methods. We will look at the existing profile, and then there will be public engagements, for example, the service users, service providers, etc. We will listen to their views. We hope that we can reach a consensus, and then we can come up with a program plan. Now we'll be looking at the following information. First, the existing and projections and the profile of the elderly persons, including the demographic data, health condition, life expectancy, etc. This kind of information will be provided by the Census and Statistics Department. Of course, the health conditions of the elders are the most important. As for life expectancy, as members may know, Hong Kong's healthcare service is very good, so our citizens enjoy long life expectancies, and they have huge demands for healthcare services. As for living condition, we will also be looking at their living environments, their financial capability, and whether they are participating in labor market, whether they have income, etc. The government is now providing a number of elderly services, and there are also several pilot projects. NGOs are providing services, not-for-profit organizations are also providing self-financing services. As for RCHEs, there are also provisions in the private market. So we will try to find out what the present situation is, and we will look at the future demand. We will also look at the present government policies. We hope that the elders can live in a dignified manner and they can have an active aging. They can take part in community activities. For example, now we have transport subsidies so that they can go to different places, and also other facilities may also be needed, for example, elevators or escalators. So we hope that by providing more facilities, they can have a more active aging. And also we'll be looking at the needs in 2030. For example, subsidized elderly services, in particular long-term care service. And also we will be looking at elderly services facilities and lands, as well as manpower. Do we have enough people to serve our elderly? We need professionals as well as RCHE staff. Well, for elderly service, now most of it is subsidized by the government. We will test the viability of this, and we will try to find out whether there are other ways of providing elderly services. We will also conduct a questionnaire survey so as to understand the views of the stakeholders and the public. And also we will be conducting interviews. We'll be talking to major stakeholders as well as relevant government departments. Focus groups will also be set up. The government is now conducting a number of reviews. For example, the standardized assessment mechanism for elderly services, because this has been implemented for a number of years. The government is trying to review it and see what improvements can be made. And also for community care vouchers, a review will be conducted and we will see how effective it is. Our team is also asked by the government to conduct a feasibility study and see if RCHE vouchers can be issued. We will also be looking at the subsidies provided to carers of elders. The audit report number 63 will be taken into careful account. We will be listening to views from different stakeholders. So as Ms. Pham said just now, our work will be structured into 3 stages. They are the scoping stage, formulation stage, and consensus stage. We have already held 5 public engagement sessions, and there have been 220 participants. They represented over 60 organizations. They've expressed their views, and they have also provided us with some submissions. And also we have a web page where the public can send their views to us. This is our address, so if you have the time, please go visit our website. As for formulation, now we will compile the information we got in the first stage, and then we will proceed on the second stage of formulation. And also we will be engaging different stakeholders. Our members come from different universities, including me and Dr. Chi Kong from Hong Kong U. Also another professor from Polytechnic University, a doctor from City University, professor from University of Calgary, one from Ningland University, and also other professionals. We hope that we can pull the wisdom of these academics and formulate the program plan. The program plan will be submitted to the government in due course. We have several members who would like to ask questions. First, Mr. Frederick Fong, 4 minutes. Just now, the Permanent Secretary also said this. In this policy addressed, the CE said that within 2 years' time, a program plan should be prepared. So this is not a consultation report. You say that in July 2016 you will be giving a report to the government. So is that a report or a plan? So for a program plan, it should have a timetable and a roadmap.
If it is a Hong Kong U report in July 2016, then it is a far cry from the planning mentioned by the CE in 2014. I don't know when the plan will be available if it is just a report by Hong Kong U in 2016. Should I ask all the questions? Well, you have 4 minutes. Go ahead. Some people have talked to me about this because they are the alliance who are concerned with home care. They got notice from you in October, but in November the consultation was concluded. In other words, from your notification to having a meeting to digging up material to giving a submission, time is quite tight. Is it that you had very little time for consultation so that some groups were given so little time? You say there will be stage 2, stage 3. Will there be more consultation? If you have in mind certain organization that you would like to consult, perhaps you should tell them on day 1 when they will have a meeting with you so they get better prepared. Number 3, a proposal, actually a proposal from the groups. They say there were cases on home care. They had to wait for 10 years for cleaning services. And then meal service, it used to be for Monday to Friday, but then one group now can only get it on odd days, so to speak, Monday, Wednesday, Fridays, and then the other group only on even days. And 10 years ago, you have 10 teams for home care, and you have the same number. 10 years down the road, there are many more elderly people. Why do you still only have 60 teams? Those are the questions. P.S. Thank you, Chair. As Mr. Feng said, in para 63 of the CE's PA, he said he would like to commission the Commission on Elderly in order to come up with a plan for elderly services within 2 years. We hope that when the Commission submits a report, it will also comment on the supply and demand for services and also manpower resources, as well as the ways to provide services, whether they are suitable and appropriate. We hope they will comment on all these issues in that report. After receiving the report, the administration will process it. Sorry, can I follow up on this one? But actually the CE said, well, I'm reading it out here, that there should be a plan made on elderly services. In other words, according to what you said, even by January 2016, but even as Dr. Chui said, July 2016, you will still not have a plan. Chairman, in that report, the Commission on Elderly will be commenting on the plan. As I said, they will particularly comment on supply and demand. You mean there will be such a plan in July 2016? They will provide comments to the administration on the plan. You will have to stand in line for a second round. But Dr. Chui has raised his hand. Dr. Chui, you have to be very brief because we have a tight agenda. Thank you, Mr. Feng, for your question. We apologize for not having done enough in stage 1, but I can tell members that we will have broad consultation, even in stage 3 and stage 2. Mr. Tam Yu Chung, Chairman, I mentioned that there should be a long-term plan for elderly services, including a 5-year plan. It seems you are finally getting down to it, but it seems you are giving me the impression that you are still dragging your feet. You say there will be experts enlisted, there will be research, and studies, and there will be consultation in the community for a consensus, etc. However, we have been talking about elderly services for very long. We all know where the problems are. You have a lot of data with you. We indeed know how to solve the problems. Say, for example, whether you should have a more comprehensive plan, whether you should supply the resources and match it with manpower, resources, etc. I think you are giving people the impression that you are dragging your feet too much. Why do you want to repeat doing what we already know? P.S. Thank you, Chairman. Actually, this elderly services program plan is to map out long-term planning for the short, medium, and long term so we can face the problem of the aging population. And as Dr. Choi said, we are not only looking at the next few years, we are going to do projection until 2030. 2030 would be the base year. As to consulting other groups and doing research, we think that is necessary since the program plan will take us to 2030. Mr. Tam, you are correct. We are not going to sit with our arms folded until the report is out. We will continue to do what we are doing. We lack RCHEs. We also have a manpower problem. We are working on them. We have a plan to encourage people with land to do redevelopment. We will not wait for the report is out. The Commission on Elderly and also the consultancy team will factor in what we are doing into their plan so we can project until 2030. Well, okay. In fact, some matters are really pressing. Before the program plan is out, whatever is urgent should be attended to. For example, I read in newspapers that the administration is investigating into combining jobs so one person can take up two kinds of jobs, and maybe you can enlist women to do part-time work in RCHEs. I think these may be short-term ad hoc measures, but you should still do them so that you don't give people the impression that you are dragging your feet. P.S. Thank you. In fact, what Mr. Tam is saying is exactly what we are doing. We will not stop what we are doing by way of short-term measures while we wait for the program plan. But the program plan will take us to 2030. Mr. Peter Chung, the chairman. Thank you. I really have something to say about this program plan. From the paper, we know that the consultancy team will in fact really just review existing programs and their progress. To me, elderly people don't only face a social welfare problem. What matters most to them is medical care. And after they retire at 60 or 65, they will easily live another 20 years. That's the average. And the community will be very different. There will be more elderly people. They will have had more high education, and there will be more professionals aging. These million-odd old people will still live, and how are we going to take care of them, especially the medical side? You are silent on medical care in this paper. If you only concentrate on welfare, this will fall short of meeting the needs of elderly people. Dr. Choi, is this your objective? Or is that the planning brief given to you by the administration? Can I please start that dialogue now? Dr. Choi, thank you for that question, Dr. Chung. As a consultancy team, we have been commissioned by the administration. We have a planning brief, but we understand and we also agree very much that we should not just look at welfare. If we talk about taking care of the elderly, there should be medical and housing and even transport needs that should be looked into. This is, of course, subsumed under the Labor and Welfare Bureau, but in the past 5 public engagement exercises, we have encouraged the participants to also comment on housing, medical care, and transportation when elderly people have to visit doctors. These will be included in the first stage report. We are not going to forget other bureau jurisdictions, but of course the focus is on labor and welfare. Perhaps I have the next question for the PS, and this is about the attitude of the administration. If the consultancy team would really look at wider issues than what the paper is telling us, I'd like to ask you whether you look at this from the perspective of the LWB or from the entire administration when you do your planning. PS. Chairman, as Dr. Choi said, when the team consulted people, they also heard comments on other aspects of elderly services, including medical care and housing. Dr. Chung would know that officials sitting on the Working Group on Elderly Services Program Plan, there would be the PS of LWB and also Department of Health as well as Housing Bureau or Housing Department representatives. They will research into manpower needs and other resources for medical care within the jurisdiction of their bureau. They are represented and these are high-ranking officials. They will cooperate amongst themselves. Chairman, allow me to give more advice to the administration. You are giving people the impression that you are focusing on welfare. The membership also concentrates on the welfare sector. You have fewer people from the medical side, maybe just 1 or 2 who know very well about medical care for the elderly. However, I think the representation has not been comprehensive. Either you expand the membership or at stage 2, you should do wider or broader consultation by also approaching the medical sector. PS, a short one. Chairman, as Mr. Chung has observed, the membership of the working group does feature medical care representatives. For example, the EC deputy chairman is a doctor himself, and amongst the officials, the PS of the FH Bureau is a member. I believe there will be sufficient reflection of medical care needs at the working group. Next, Mr. Leung Yu-chung. Thank you, Chairman. I think I share the feelings of my colleagues. You are doing some long-term planning. No one will object to it. You say it will take us to 2030. This is better than taking a step at a time and concentrating only on the present. However, if we have to cast our eyes to 2030, there will just be proposals, and then they will just be for your consideration before we can implement them. So you are telling about the next term of government. Can you do something within this term of government to implement the proposals? Well, I have doubts about that. So can you compress the timetable? You don't need 3 stages. For example, maybe 2 will be enough, so you can quicken the pace of your work. That's the first point. Secondly, I don't know how complicated the issues are in your mind, but I think the biggest point is resources. As we said in the last topic, institutional care. You need to build them. You also have to have recurrent expenditure, but you first of all have to find a site. That's important. But this is not a problem that can be solved by just making a proposal. You have to talk to the departments. Last year, we already said that in PRH estates, we can have at least one story in every block to be used as an RSHE. And your colleagues have said that there could just be one facility within an estate. And they said they will take it back.
We have talked about this for a long time, but the government has turned a deaf ear to us. So can it really go so smoothly? That is, just with this program plan, the problem can be resolved. Do you have enough power to ask all the other government departments to cooperate with you? There are a lot of issues, transport, housing, healthcare. These have been long-standing problems. Or, for example, rehab bus. The elders have to use it. How about the number of rehab bus? It's still far from sufficient. I asked you to increase the number of it. You say that, no, we only have this limited resources. So you have been just doing lip service because you say that you don't have resources. Resources include funds, size, and manpower. So how can all these problems be resolved? P.S. Thank you. Now, if we are formulating a program plan and we have to look at 2030, actually that's very adequate because we need a long-term plan. And also Mr. Tam mentioned just now, in the interim, is not that we will not do anything. The Labour and Welfare Bureau as well as the SWD will still be doing their work. And we will be looking at their recommendations. And internally, we'll be liaising with other bureaus and departments. For example, finding suitable sites and communicating with the housing department, the planning department, etc. We have already started to talk to these bureaus and departments. We will try to align our work. We will not just sit and wait for the conclusion of the program plan. A lot of government departments are providing us with very good support. Dr. Poon Siu-ping. Thank you, Chairman. Just now you talked about the 5 focus group meetings, and there were 60 organizations attending. 3 of them were participated by elderly services providers. But how about frontline workers? And also, how about the training institutions in this sector? Well, we have talked about elderly services for a number of times. For example, we just had a joint committee on long-term care service, and there was a report. So what will you be doing to that report? Will you take on board its recommendations? At the past 5 sessions, we have talked to different people, including frontline workers, the unions, representatives, etc. And also training institutions, including tertiary institutions and professional bodies. They have also been invited. Not all of them have attended our meetings. Some of them did. And I would like to respond to the question concerning the time we need to use now, because now a number of programs are pilot schemes. For example, the community care vouchers. So all these are being implemented. So we want to monitor their progress, and then we will look at the results. So that's why we will. It will take quite a long time. As for other stakeholders in the 2nd and 3rd stage, we will continue to invite them to take part in our dialogues. Dr. Poon. You've asked all your questions? Okay. Dr. Fernando Zhang is not here. Mr. Tan Kapil. Now there is a medium and long-term plan. Actually, we've been talking about this for a long time. We focused on this a lot in the past. We think elderly service is very important. And because if we gather enough information and data, we can provide better services for the elderly. I would like to make 2 points. Now, you are most concerned about resources, manpower, and I think financial sustainability is also important. Yes, I understand that if we want to provide good elderly services, there is a lot of money. For example, $30,000 for a month in a good CHE. So for long-term care, I understand that for the EC, that is European Commission, they have been talking about this for a long time. They have been talking about a contribution system. So would you also consider this? Because now there is no means test. You just look at the physical condition of an elder, and then appropriate service will be provided. So are you going to break this pattern? Well, for our team, we also have some overseas academics. In 2009, I was asked by the government to conduct a study on RCHE and another study on community care. I have also looked at other countries' practices, for example, insurance, means test, contributions, etc. For the consultant team, now we do not have an established view. We would provide different options to the government. There is one thing very important, that is the forging of consensus, because we need this to be well received by the public. We will be providing different options to the elderly commission, and we will let the public and stakeholders know the advantages and disadvantages of different options. P.S. Well, Professor Nelson Chen made a study on retirement protection, and before he submitted his report, the report had to be shown to the relevant government officials. Would that happen again? Because this is actually about spending a lot of money. The member mentioned Mr. Nelson Chow's report. Well, what you depicted didn't happen. Our Bureau will adopt an open attitude. We will follow up on this program plan. The consultants team and the EC will discuss different options. We will help them understand the implications of such options. For example, the number of people served, fiscal sustainability, etc. I believe the EC and the consultants team, when they provide or when they submit the reports to the governments, they would analyze the advantages and disadvantages of different options, the implications, etc. And also they would be making projections as to how the financial situation will be. Now, the financial secretary has already said that in the future, government spending may be cut. Would your work be affected? I don't think the team will take this into consideration. Now, when it comes to sustainability, we will have to look at different models, whether it's paid for by public money or it's a contribution system, etc. We will look at it from an academic point of view. Now, if the population increases and if the economy changes, then we will use different models to come up with different results. So different options will be provided to the EC for considerations. Dr. Fernando Zhang. Now, for this elderly services program plan, of course, is important. As for the LegCo's long-term service joint committee, we have also put together a report. We say that, well, for rehabilitation service, elderly service, they should be done at the same time, but the government has already rejected us. We put forward dozens of recommendations. The government has turned down most of them. I really feel disappointed. The government's reluctant to do that. And the LegCo and some community organizations conducted surveys, and the government said, thank you for your opinion, but I will maintain the status quo. Now for this program plan, it seems that the government wants to launch an LCHE voucher, and it will also make reference to audit reports. But if you look at the audit reports, well, just now a elderly community care voucher has been launched. Now, after a year, the quota is filled 1,200, but 27% of the users have already withdrawn from the plan. So for this kind of voucher scheme is self-financing, and you say that the money follow the user. Actually, I don't think it's viable. Well, Dr. Choi, several years ago, you put together another consultancy report, and you objected to this system of money follow the user. You think this kind of voucher scheme is not viable, and now the government asks you to conduct yet another survey on LCHE voucher. So now you are going back on what you said before. So the government says that, asks you to do it again, and you now say it's okay. You already conducted a study proving that it's not feasible, and now you do it again. So what really does it mean? Well, for the 09 reports, yes, I was one of the responsible members on the team. We thought that at that time, if it's launched, then there will be some induced demand. And some people who do not have urgent needs for LCHE, because there is such a subsidy, they would use the service. So we looked at the population, and we looked at the level of disability. And when we did it in 2009, we conducted a questionnaire survey. We came up with this conclusion, that is, there will be an induced need. So that's why we said that maybe we should consider enhancing community care first, so that there would not be any induced needs. Now the government has launched a community care voucher. Professor Zhang queries its effectiveness. So I think another study should be done on its effect. Now we still do not know whether it's good or not to have this kind of voucher scheme. We have to do a study. I think the most important thing is to introduce a means test. So it will be regarded as another form of poverty alleviation. But this is the wrong path. Madam Chair, I'm really worried. Well, for retirement protection, it's the same. For elderly services, it's the same. So in the future, for rehabilitation services, I'm sure it's the same. Such fundamental social services, you have to draw a line. Unless you are in abject poverty, otherwise you won't be assisted. Then the whole society will go downwards. If you look at the past decade, if you look at Leo Gusta's book, last year he published a book, and you can see clearly why there are so much more grievances, because all the services are getting privatized. Okay, now I would like to ask a question. For our panel, we are positive when it comes to the government's provision of elderly services, and we also agree that a supernumerary post be added so that he can work for the program plan.
In other words, members of different political affiliation have supported you, but let me tell you the views of members. Mr. Tam Yu Chung has been the chairman of the EC for very long, and he has all the information. Why does it take you so long to come up with a plan? And Dr. Fernando Zheng and other members who have left the room have been talking about this. So my view is, even if we support your project, and we also thank professionals like the Dr. Choi for doing this, but the community has already given you a lot of comments on elderly services over a long period of time. So I am a little shocked. I have come back to the LegCo this time, and many young people are commenting on elderly services. It is not for the elderly talking about retirement protection, but even the young are talking about this. Therefore, we can see all these grievances in the community. The community is changing fast. What have we been talking about? As I said, and those who work on a district level would know, first of all is the economy, secondly medical care. All these are important factors. If you want to get prepared for 2030, we support you, but you have to be sure you do it in the right direction. If you don't get prepared for rainy days, you will face a huge problem. So first, the economy. Just this morning, we were talking about RCHEs, and then again, in August this year, we asked the administration at the FC that whenever you build PRH, you should reserve places for RCHEs and RCHDs. But too bad, you just rehash your old points. You say in Shatin, oh, there will be a welfare block, etc. But you have not been responding in a targeted manner. We have heard that there are vacant units in PRH in the lower floors, but have you changed your policy? The thing boils down to resolve on the part of the administration. A few thousand old people die while they wait for institutional care every year. Your LWB and Development Bureau, as well as the Home Affairs Bureau, should put your heads together. If you are still talking about the 7 projects, including Shatin O, that tells me that you are not taking a targeted approach. We need both residential as well as daycare centers. So, first of all, economy, second, medical care, 3, sites, and 4, your housing policy. We see abuse of the elderly quite often. And Dr. Choi, please avail yourself to the discussion at LegCo in the past few years. We have been giving or tendering advice to the administration. But unfortunately, as Dr. Chung was asking, what is the direction the administration is going to take? If you really want to provide services for the elderly, you have to do a good job, and then the Elderly Commission, ourselves, and the community all have to put their efforts together. And in fact, a lot of reports have been submitted together with Dr. Chung. We have said that LegCo should concentrate on elderly and disabled people. You know this is the focus of our work in these 2 years. But what can you do? So Dr. Choi, the community has got negative comments on your first stage consultation. They said it was very rushed. But objectively, we have commented on these issues many times. In fact, the community has done its utmost, but the administration has just not responded. We have 400,000 women who are prevented from working. But they want to work. They want to stay at home at the same time to take care of elderly people and the children. But nothing has been done for over a decade, Dr. Choi. You say we are the pro-establishment camp, but we are also quite agitated with the administration. You really have to take stock as to why you cannot tackle problems across the bureaus. And elderly services is a case in point, and you must avail yourselves to the economy, housing, medical care, etc. I need no response from you, Dr. Choi, but this is our summary, this is our attitude. People on the panel are elderly people or old hands, let's say. We have been here for more than one term. Second round, Dr. Fernando Zhang and KK Fong, just 2 minutes, 3 minutes, all right. Chairman, I will still emphasize that the platform of the CE said that there would be a plan within 2 years. A plan is not just a report. A report is just a proposal, and you have to submit it to the EC and then to the administration for the administration to come up with a plan. I can say for sure there will be no plan in 2016 using your present timetable. CY Leung has again lied. I will stand to be corrected. I am saying within 24 months you can submit a plan. P.S. You have to answer this. Secondly, Dr. Choi. I learned about elderly services in Europe. They did what we are doing in the 90s. But now, Europe does not only take care of elderly people with urgent needs. In Europe, there are elderly organizations which were like us in the 90s, but now they don't ask you for services or resources. They ask you for sites only, because the elderly will be able to have their own dentists, doctors, and other professionals to help them. They just need land from the administration. So, Dr. Choi, if your report is about a long-term vision, you should not be stuck in the present situation. Look at the US and Europe. That is what people are doing by way of elderly services. So you should mention or propose other platforms for providing elderly services, because elderly people will be able to manage their own services and make their own plans. I think you should factor this into your proposal or report. P.S. I'll take the first question. Actually, when Mr. Fong talked for the first time, I already said that para 63 of the PA commissioned the EC to come up with a proposal plan for elderly services and make a plan within 2 years. In other words, when they submit the report, there should be a plan included. It is a report on elderly services. Sorry, because of time, I would have to intercept. Here, the PA says there will be a plan. It is not for the report to make a plan. P.S. I was reading from para 63 of the PA. Indeed, the PA says that within 2 years there should be a service plan. But the program plan is to make plans for services. The EC will submit the plan to the administration, which will consider how to implement it. But as I said, we would hope to implement the program plan ASAP, and we are following progress closely. If we can do anything by way of advance work to implement the plan, we will certainly do it. Fernando Zhang, second round, 3 minutes. A very brief one. There will be 3 stages of public engagement. I'd like to ask whether there will be preliminary reports resulting from these 3 stages, so the public will get to know what information you have received and whether you would have any initial response, so we don't have to wait till the very last stage before they know what you want to do and make their comments. P.S. Dr. Choi? Thank you, Dr. Zhang. We submit reports to the working group at every stage. Whether the working group will use it for consultation, that's for the working group to decide. But the administration has asked us to submit reports at different stages to the working group. Mr. Feng mentioned Europe and other countries. We have overseas academics on our team, and in our brief, we are asked to look at different countries, not just in Europe, but also from Asia. After all, we are a Chinese community. Maybe we should also look at the cultural factor. And we have also done a study on the gray hair market. So we don't only look at urgent needs or meeting the needs of the poor elderly. As we said, there will be elderly people with different academic backgrounds and income levels. And maybe some of them can become promoters instead of people who receive the service. We will make reference to all these in the present report. I hope the consultancy team or the working group will be as transparent as possible, allowing for as much participation by the public as possible. I hope these reports from the consultancy team would be made public. As Mr. Feng and also Dr. Choi were saying, it is important for the elderly to be able to participate. I hope you will work in a transparent manner. Right, thank you very much, Dr. Choi and the officials for coming. Members. Thank you very much. Thank you, administration. I'd like to ask members whether you have any other comments to make. Anything else? If not, the meeting is adjourned. Thank you very much. Thank you all.